Welcome friends, I am Dr. V.K. Chauhan, homeopathic physician. Revise with me homeopathic remedy Berberis vulgaris. This is part 2, general overview in a classical format. The text is being taken up from Allen's keynote, and this is good for BHMS students and interns. First, we'll go to the general information which is not given in Allen's keynote. The remedy profile. Berberis is an important remedy for renal and gouty affections. It belongs to vegetable kingdom and its natural order is Berberiaceae. Habitat, it grows in Europe and it is indigenous to Britain. Historically, we find that the use of Berberis vulgaris in Chinese medicine dates back to over 3,000 years, and in some other countries it is over 2,500 years. The preparation is mother tincture is prepared from bark of the root, and the remedy was first proved by Dr. Hesse of Germany in 1834. The organ tissue affinity is kidneys, bladder, ureter, liver, digestive tract, lumbar region, joints, uterus, and spermatic cord. Let us go to the proper review from Allen's keynote with certain additions here and there. The somatic predilectation, we find the patient has somatically physical attributes include pale, earthy complexion with sunken cheeks and hollow, blue encircled eyes. So there is lot of weight loss, pallid and sickly, old and worn out, prematurely old and wrinkled, male and female. We find this information comes from Kent, Materia Medica. Acts well in fleshy persons, good livers, but with little endurance is the reference from Boric Materia Medica. Side affinity, it is a left-sided remedy, and the reference is from second grade rubric Kent's Repertory Generalities. Thermal affinity being ambithermal. Psychic preponderance, we find the temperament is melancholic, and this information comes from Clark. Mentally, the patient is apathetic and indifferent. This information comes from Boric Materia Medica. Dreams are anxious. This is a 1+ rubric in Kent Repertory. And desire, we don't find any particular information in this reference. The causation. In causation, we see diathesis, and we find in Allen's rheumatic and gouty complaints with diseases of urinary organs, colic from gallstones, or you can say the rheumatic, gouty, bilious, and lithic diathesis. Ailments from, we find that there is a short cough and chest complaints, especially after operations for fistula. Similar remedy being Calcarea fos and Silesia. We go to the characteristics of this remedy, and here we find in the back region the renal or vesical symptoms predominant. This is the system affected. Pain in small of back, very sensitive to touch in renal region, worse when sitting and lying from jar, from fatigue. So, along with this, burning and soreness in the region of kidney constitute the main complaint. Numbness, stiffness, lameness with painful pressure in renal and lumbar region can be taken off as concomitant symptoms along with main symptom of renal and vesical region and burning, soreness and pain in the back of small. In GIT we find colic from gallstones, bilious colic followed by jaundice, clay-colored stools, fistula in ano with bilious symptoms and itching of the parts. In again characteristics we find urinary symptoms, and that is stitching, cutting pains from left kidney following course of ureter into the bladder and urethra. Renal colic which is worse on the left side, and tobacco is for either side. With urging and strangury we find similar symptom in cantharis. Rubbing sensation in kidneys, here the reference is medurinum, similar symptom. Urine is greenish, blood red with thick slimy mucus. Transparent reddish or jelly-like sediments are there. Movements bring on or increase the urinary complaints. So we go to the relationship and we find similar remedies to Berberis, Cantharis, Lycocerceprilla tabacum in renal colic, and it acts well after arnica, bryonia, calibichromicum, rustox, and sulfur in rheumatic affections. General modalities, we find Ellen has not given general modalities here. However, we find aggravation by motion, walking, or carriage riding, or any sudden jarring movements. And emulsion is also not given in Ellen as well as boric materia medica. So miasmatic orientation of this remedy will be based on certain miasmatic markers, and they include gouty rheumatic lithic diathesis points to psychotic trait. So the impression is that Berberis vulgaris is a predominant psychotic miasmatic remedy. On posology part we find doses tincture to 6 potency in organopathic disorders. Higher potencies when the kidney's keynote characteristic symptoms are present. Repetition. It is to be repeated in specific and organopathic disorders. Single dose of the higher potency when keynote characteristic symptoms are present. Duration of action is not very definite. We find clinical conditions where it is most suitably indicated renal calculi, especially on the left side, cystitis, dysuria, gallstones, biliary colic, and obstructive jaundice. Friends, thank you very much for patient listening.